Hello, everyone. Good morning, good afternoon, good evening, depending on where you are in the world. We welcome those who are joining us by webcast this morning. My name is Kimberly Scott. I'm the staff director of the IOM's Forum on Public-Private Partnerships for Global Health and Safety. Before we begin our program, I just have a few housekeeping details for you. For those speakers who need a little more time to tweak their presentations, we actually have a room set aside for you. If you will just contact any of the IOM staff who are wearing green name tags, we can direct you to that room and that computer resource if you need it. We will have an overflow webcast room, which is in Keck 106. And of course, all of you, by being here and in front of the camera, agree that you will have your likeness over the airwaves. For speakers, we do have a timing system. We have a lot of people who have put together, we think, some really interesting presentations for you. The timing system is visible here from the podium. It is a red, green, yellow light system. So when the green light goes on, go. When the yellow light comes on, you have 5 minutes left. When the red light comes on and it's blinking, your time is up. If you're still enthusiastically presenting your presentation, I have a sign that I'll hold up that says your time is up. Thank you. We have intentionally designed this workshop to provide not only opportunities for some presentations, but also plenty of time for question and answer. So we hope that you all enjoy the program and we have ample time for robust discussion. The workshop planning committee members who will be mentioned by name shortly, I just wanted to say thank you to them. We could not have done this without you, and there are purple dots on their name tags if you see them milling about during breaks. We also have 3x5 index cards that are out on the registration table. We encourage you to grab those for breaks if you would like to ask questions to the panelists. It's a way to help us make sure that we get a number of questions in. Even if it's not during that Q&A period, we can revisit those questions. We do have chimes to signal when the sessions are beginning, so if you're out in the lobby area and you hear the chimes, please come back in. If you are advancing your own slides, there's a clicker here for presenters. If not, Rachel Taylor, sitting directly in front of me, will advance your slides. Just say, next slide, please. And at the end of the workshop, we appreciate you taking some time, just a minute, to fill out an evaluation form. We have a hard copy for in-person attendees, and we have an electronic copy for webcast participants. So we thank you for coming to the inaugural activity, workshop anyway, of the Forum on Public-Private Partnerships for Global Health and Safety. And I'd like to introduce the Director of the Board on Global Health and the Director of the Board on African Sciences Academies Development, Dr. Patrick Kelley.
Thank you, Kimberly, and welcome, everyone. I'm very, very pleased to offer a welcome to this wonderful workshop that's been planned on approaches to universal health coverage and occupational health and safety for the informal workforce in developing countries. As Kimberly said, my name is Pat Kelley, and here at the National Academies, I direct the Board on Global Health and the Board on African Science Academy Development. As she noted, this is the first public gathering of the Forum on Public-Private Partnerships for Global Health and Safety. Though this has been an activity in planning for over 2 years. I wanted to just begin by telling you a little bit about what a forum is. Here at the Institute of Medicine, we have about 20 forums. Some are known as forums, some are known as roundtables. But in every case, they are appointed groups of individuals drawn from multiple government agencies, industry, academia, foundations, and professional associations that comes together several times a year in an ongoing fashion for state-of-the-art workshops dealing with the forum's overarching theme, which in this case is public-private partnerships. We have found this to be an extremely successful model at the Institute of Medicine for illuminating and bringing together multiple sectors. We have forums on everything from violence prevention to microbial threats to food and nutrition. It has turned out to be one of the most effective ways at the IOM that we can engage broad audiences and build partnerships across sectors. The forum is known for the forums are known for the scholarly content that they produce. But I would like to claim that a very, very important part of being part of a forum are the relationships that are developed. And some of our fora have been in existence now for well over 15 years. And that speaks to, I think, the quality of not only the intellectual exchange, but also the dynamic created between the forum members and between the sectors that they represent. This forum on public-private partnerships grew out of a strategic planning meeting that the Board on Global Health had in 2011. My good friend Clarion Johnson at the time was on my board as a representative of ExxonMobil Corporation and urged us to reach out more intentionally to the corporate sector and explore more specifically their role, their growing role in global health. When I was in medical school, corporate occupational physicians very much seemed to work within the walls of a factory. But now, as I learned from Clarion, they really are global public health physicians and often very involved with ministries of health and universities around the world in delivering global health, especially now that more and more health falls outside the realm of the public sector and is provided through the private sector. Our forum evolved from the initial idea that Clarion gave us to really focus on public-private partnerships, to bring companies together with all of the sectors involved in global health. And we also decided intentionally to go beyond what I might call the usual suspects, that is, the companies that have led in global health for many decades, especially leaders in the pharmaceutical industry and the medical device industry. So you will see in this forum, we not only have companies involved that have been working in this area for decades, but we have companies representing the petroleum industry, the food and beverage industry, the cosmetics industry, the telecommunications industry, and quite a few others, the chemical industry. And we have a belief that all of these companies can bring unique insights to the forum and can take away unique insights from the forum. And working with the partners from the other sectors, the foundations and the NGOs, that something extremely valuable can be created. Currently, the forum has 39 members. About 3/4 of them are drawn from sponsoring organizations, that is, entities that are contributing financially to the forum. And at this point, I would just like to specially acknowledge the Rockefeller Foundation, which is providing the funding for this workshop to address occupational health and universal health coverage for the informal workforce. My job this morning is primarily to introduce two wonderful individuals who both happen to be cardiologists. So if things get too exciting, we're well covered. To my immediate right is my good friend, Dr. Clarion Johnson. Clarion, as I noted, is a member of the advisory board for the Board on Global Health. He serves on many, many boards, including the Joint Commission for the Accreditation of Healthcare Facilities. And he spent most of his career after his cardiology training working in corporate occupational health for Mobil and then ExxonMobil, traveling all around the world, working with foreign governments and countries to really bring global health to the thousands and thousands of workers working for his company, as well as to those in the communities surrounding places where Exxon has a presence. Clarion not only gave us the idea for this forum, but he volunteered, or was volunteered, to be the co-chair of it with Joe Ivy Buford. Dr. Buford is unable to be with us this morning. Dr. Buford also serves as the Foreign Secretary for the Institute of Medicine and has been very engaged with the development of the concept for the forum. Before Clarion speaks, we're asking for some words of welcome from our brand new president of the Institute of Medicine, Dr. Victor Zhao. Dr. Zhao took on the role as the 7th president of the Institute of Medicine on July 1st of this year. So he hasn't even been with us in the presidency for a month. But he has been a member of the Institute of Medicine since 1998 and has been very active in the governance of the Institute of Medicine through service on our governing council for a number of years. I'm very, very happy to welcome Dr. Zhao to the Forum on Public-Private Partnerships because he has clearly articulated a very specific desire to be involved with the work of the forum. He brings a very rich background to the IOM and to this forum. After his clinical training in cardiology, he moved up the academic ladder to chair internal medicine at Stanford and then at the Brigham and Women's Hospital in Boston. But for most of the last decade, he has served as the Chancellor for Health Affairs at Duke and as the President and CEO of the Duke University Medical Center. But his work was not confined to Durham, North Carolina, or even North Carolina. He pioneered at Duke the establishment of Duke's Global Health Institute. He helped establish the U.S.-Singapore National Medical School. And he, at Duke, also established the Duke Institute for Health Innovation. And I'm very much looking forward to him blending his global perspective and his inclinations to be innovative into his work here at the IOM and specifically in his collaborations with us in the Public-Private Partnership Forum. I wanted to just mention that the Duke Institute for Health Innovation has a major focus on implementation and health delivery science. That's very relevant to the topic that we'll be tackling today. So he has given this sort of issue quite a bit of thought. One manifestation of his leadership at Duke was a partnership between Duke Medicine, the World Economic Forum, and McKinsey & Company to establish the International Partnership for Innovative Healthcare Delivery. Again, something quite relevant to what we'll be talking about today. So as you can see, Dr. Zhao's presence among us is not merely ceremonial. We are trying to achieve with the forum something that is quite aligned with his own career trajectory. And I would like to, at this point in time, welcome Dr. Zhao to the podium to give us his opening remarks.